got a lot of bone tissue, but because it's an organ, we have an awful lot of other tissues as well. Okay, so this is a femur from a cow, and it's cut right longitudinally. This is the proximal end. Here's the head. Okay, this is posterior, anterior, and then we have one of the condyles here. So this is the head. What condyle is this that we have? Do you know? Medial condyle. Good. Okay, so this is a right or a left femur?
It's left.
It's a left.
This is as though it's my femur. So right now you have it articulating to somebody else's body, right? Okay, this is a right. Because the head points medial, it needs to attach to my os coxa, right? So that's a right.
So that's what I said.
My right. Now I'll turn around. Now it's your right too.
Oh, okay.
That's why I'm saying when you're in the exam, pick up the bones and hold them the way they go in your body. And always people ask, is it my right or is it the patient's right? It's the patient's right. They're the one with the, the right broken femur, so you're casting theirs, not yours, right? So you got it. So they're facing you in the anatomical position, which means everything's opposite you. But take them and hold them the way they go in your body, and that's how you can be sure. Okay, now we're going to look for, since this is a bone organ, we're going to go through tissues, different tissues. And yes, the tissues, they're different tissues, and so you can name what kind of tissue they are. But also as part of an organ, they have a name, a structure name. So you can always give a name to something and then tell me the histology makeup. Okay, well, so we'll go through those, but then we also have some gross anatomy. So we call this part, does anyone remember what this part of a long bone?
Yeah,
the diaphysis. So dia means it attaches two things together, and this is what the two things are. So what are these called? Epiphyses. Yeah, epiphyses. Okay, so the ends of the epiphyses, and now this is probably not a very young cow, because we do not have much in the way of an epiphyseal disc or line, but I think I can see a faint line right here, because what happens to the epiphyseal growth plate once the growth stops? It calcifies, it turns into bone, so we don't see that little strip of hyaline cartilage. Okay, and sometimes we get a young cow bone, but we don't have one here. So that's why I showed you on the x-ray. We can really see in the kids' x-rays that epiphyseal plate, growth plate, because it's soft tissue, it's cartilage, and so it doesn't show up as white. In the x-ray, it shows up as a dark line. Okay, so those are just some gross structures. Now let's look at the bone tissue, since that makes up really a lot of the bone organ. And so when we look at the diaphysis here, we see, well, first of all, I'm going to take some of this out. Okay. And so we see we have a space here. What is that space called? Yeah, medullary cavity. And then when I run a probe here, a pointy probe, on this bone that makes up this diaphysis, it sounds pretty solid, right? Compact bone. So we would call that kind of bone tissue compact bone tissue. But really, when you look in the microscope, you know from looking in the microscope, it is porous, right? It has lacuna, it has canaliculi, it has central canals, and those are all spaces in here. Okay, it's just that they're not small enough for my probe to get stuck in. But here, what's my probe getting stuck in? Well, we didn't name it. Yeah, the spaces between the spongy bone and the spongy bone tissue itself. Yeah, we call it spongy bone or cancellous bone. And the actual bone tissue forms what we call trabeculae or spicules. And so those are what I'm actually able to break here. You can actually break it. So you say, well, that's not very strong tissue, bone tissue. But it is strong. And it's strong because if you look at, we do have some real... we do have one that's cut here. I'm going to get it and show you. And you see that those trabeculae are lined up in a particular way. They're not just in there haphazardly. So you see they kind of have a pattern. And that pattern is actually is there in a particular orientation, because that's the forces. Those are the directions of the forces that this bone has to withstand. So yeah, it's more fragile than the compact bone, but we don't need compact bone everywhere, because this is really actually very strong because of the alignment of the trabeculae. So people who, you know, make aircraft actually often think about bone and look at bone as to get ideas on how to make something light but strong. Okay. Okay, so that's in there. The spongy bone is in here. And then when we get down to here, we can see we get to a point where the medullary cavity is going to end, and then we start having just this spongy bone. So most of the spongy bone is in the epiphyses of a long bone, but where else do we have spongy bone inside of a bone?
The long bone.
In it, well, long bones in the epiphyses, but in a flat bone, it will have spongy bone filling the interior of that bone. Okay, now this stuff that I took out of the medullary cavity, what is this called?
Is that marrow?
Yeah, it's bone marrow, but what kind? Yellow bone marrow. And what is the histology? Adipose connective tissue. Yeah, and it looks a little red. You see, even though we call it yellow bone marrow, it does have some blood in it because blood vessels are in here so that we can get that fat out of there if we're starving. Yeah, it feels like lard. So if you buy a bucket of lard, that's what this is.
So if you're a bone marrow donor, that's where they get it from?
No, they're not taking this.
Okay.
Not yellow bone marrow. They don't want the fat. They want the red bone marrow.
Gotcha.
Now the red bone marrow is in between the trabeculae of the spongy bone, the spaces of the spongy bone. Okay, and in this bone, and this is true in us too, by the time we get older, we don't have as much red bone marrow in our long bones, but we retain it in our flat bones. So when they do a tissue matching, and they need to match for bone marrow, for example, you want to be a donor for bone marrow donor, they're going to take that bone marrow from your pelvic bones is the usual place to do it. Although now I heard that they have a procedure now where they can actually get the bone marrow cells, the precursor cells from your blood actually. So you don't have to have that painful procedure where they go in your pelvis. Pardon?
It's long 6 hours.
Oh, really? Oh, okay. Because what they're doing is they're taking the blood, but they're not using the whole blood, so they have to separate. Yeah.
I have a question.
Yeah.
I don't know how this is going to sound, but does bone marrow regrow?
Yeah, and that's why you can take it, and it regrows.
Okay.
And that's why it's actually has stem cells for your blood. And that's why we say red bone marrow is where all of your red blood cells are born. Because some of your red blood cells only live for 3 days. So your bone marrow is always regenerating. Those are your red blood cells. They go to your spleen and they die in 3 days. So you have to always be making them. Your white blood cells live longer. But still, like 300 days or something like that. Although some of them you keep for years and years, and those would be some of your lymphocytes. Because they retain a memory, of your immune past, what you've been exposed to. Okay, so we have the yellow bone marrow made of adipose connective tissue. What is the red bone marrow made of? What kind of tissue? Reticular connective tissue, yeah. Okay, and that's in the spaces of the spongy bone. Okay, so we got more tissues, right? Okay, let's go to the, the surface of the bone. And this I got from the grocery store, right? Not Stater Brothers, but another one. Actually across from Charlie Brown's and Pear Blossom. But some of this is naked because they took off all the meat and everything. And so they removed some of the periosteum, but we still have some right here. And that's what I pulled away here. And this is so tough, this stuff.
And that was the same stuff we saw in the rat when you pulled the skin up.
Yeah.
The white.
No, that was a realer connective tissue.
Okay.
Okay, which is much more delicate. It's a loose connective tissue. This, what kind of tissue is this made of? Yeah, we could call it fibrous, but dense irregular connective tissue is what we've been calling it.
And that's periosteum?
Periosteum, okay. Really tough stuff. And when you pull this away, and when you go to play with this after I finish talking, you can, look at it. You'll see that the reason it sticks to the bone so much is because the collagen fibers, which is why we call it fibrous, it's collagen fibers, they actually penetrate into the bone, into all of those little spaces, which are the central canals, the perforating, we call them perforating canals.
Is that the same as the crab-leg theory with the stuff that comes out?
No, that's muscle, that's something totally different. So the collagen fibers just actually go into any little opening in the bone, because bone is porous, and that's why it really sticks there. Okay, now on the inside surface there are cells. And what kind of cells live inside here? Osteoblasts. Yeah, osteoblasts. And what other kind of cells?
Osteocytes.
No, not osteocytes. Osteoclasts. The osteocytes are trapped inside here, inside the lacuna in the bone tissue. Okay. Okay, so if you do exercise and the muscles pull on this periosteum, they're going to stimulate those cells to grow bone matrix and make it thicker. Or if you break the bone, they're going to start healing that bone by making more matrix and then molding it with the osteoclast into the right shape for the bone organ. So you don't have a big clump of bone tissue sticking out here. Okay, let's look at this tissue right here. What is this stuff? Look at this slick. And it's just on the ends, like two caps. And sometimes if you eat chicken and you cook that, this comes off. Yeah, it's cartilage. What is the name of this structure, though?
Articular cartilage.
Articular cartilage. And then what is the histology of this tissue? Hyaline cartilage, connective tissue. Yeah. And it's really kind of slippery. And we can actually, I made some fake osteoarthritis, because osteoarthritis is what kind of arthritis? What happens in osteoarthritis? Yeah, it's worn away actually by activity, and or by age. Activity, okay? And it does, and arthritis in general is a joint swelling, but it's caused by that wearing away. So osteoarthritis is where this goes away. Okay, now let's say I'm, I have to swing a sledgehammer all my life, right? And so this has happened to my cartilage.
Wow.
My articular cartilage. It's not that thick. And I'm already down to the bone here. Okay, so you see it's kind of thin. So that can get worn away. And so now you have these spots that are worn, and that's the osteoarthritis.
And it's not regenerative.
And it doesn't regenerate, because does this look bloody?
No.
Not very. It's not vascularized. Okay, and the way that these cells stay alive, the chondrocytes, is by the synovial fluid, because actually, even though we don't have the whole synovial membrane here, my hand is in the space that would be the synovial cavity. And so this has direct contact and is bathed by the synovial fluid. And that's what keeps it alive. Okay, so we get another structure made of another tissue. And then we have, well, let's look at this. This is actually part of the joint. This is kind of cool because we can see a meniscus. What is a meniscus made of? Fibrocartilage. So whereas this is really kind of stiff and making a more structural, solid structure that has a shape that doesn't distort too much, this one can really distort, and that's its function, to actually press and squeeze and then spring back. That's resilient. So this is meniscal cartilage, and it's made of fibrocartilage. So you can play with that and check it out. And you see how it is a C, and on the periphery of the joint it's thick, and then it tapers down like a wedge to be very thin, more in the interior of the joint. Okay, so we'll see these again in the intact joint, but it's kind of cool that we have this here. Usually we don't get this with the femur, that we can see a meniscus. Okay, this meniscus, though, we said this was the medial half of the femur. So which meniscal cartilage is this one going to be? The medial. The head always points medial. That's your clue, okay? So this is going to be the medial meniscus. Okay, and this is the medial condyle. Okay, so let's now look at the knee joint. Okay, and I'm going to take this over here. And all of these structures that I'm pointing out, yeah, they're listed in